and welcome back. You're still watching Africa Live with Doyin Owoeye. My next guest is Iyamide Thomas, the NHS Engagement Lead for Sickle Cell Society. Iyamide, you're welcome to Africa Live.
Thanks for having me.
So tell us, what is sickle cell?
Okay, sickle cell, you can actually say sickle cell disease, and that's a collective term to describe a series of related inherited blood conditions. The most common one is sickle cell anemia, but there are others. And the blood conditions can cause severe pain, anemia, and organ damage.
Okay, when you say organ damage, what does that mean?
Well, let me say what sickle cell is. It affects the hemoglobin in your blood. It's a genetic condition, which means you were born with it, so you can't catch it in mid-life or anything like that. And it causes your red blood cells, which are normally round, to change to a banana or sickle shape. Sickle is a curved cutlass. That's where it gets its name from. The half moon shape. These round blood cells give up oxygen and they change to the half moon shape, start getting stuck through your blood vessels, and that is what deprives oxygen from reaching your various organs, and over time that causes organ damage. But in the meantime, it also causes severe pain known as a crisis. Some of your readers might have heard, your listeners, might have heard of crisis, when you have the severe pain, and then in time you get anemic as well, because those sickle blood cells don't last as long as the round blood cells. They get destroyed, so that's the sort of anemia. It's not an iron deficient anemia, it's a shortage of red blood cells that causes the anemia. So it's important for people to know that as well.
Okay, so the anemia is one of the traits of sickle cell disease, and then the pain in the bone as well is one of the traits. What other traits can people look out for?
Don't use the word trait. I know why I'm saying that, because trait in the sickle cell world means that you have one copy of the sickle gene. To have the full-blown condition, you need 2 copies of the gene. You should have inherited this defective gene from one from your mom and one from your dad. Sorry, let me rephrase that. Let me not say defective. Let me say, I don't even want to use the word abnormal, because there's so much stigma around sickle cell, so we have to be very careful. If you have a normal, there I go again. If you have the usual gene for hemoglobin, your hemoglobin AA, that's your genotype. Some of your viewers might have heard the word genotype as well. If you're AA, it means you don't have a sickle cell gene in you. If you're AS, you are the trait. That's why I said don't use the word trait, because people mix it up. But in the UK, that AS also means carrier status. You're known as a carrier.
So if you're a carrier, are you in any kind of danger?
If you're a carrier, you're AS, and what you should know is that if you're going for an operation, a general anesthesia, you might need to have extra oxygen, because people who are carriers, their blood does sickle a bit, it turns to that shape, but not enough to give them symptoms. They're not full-blown sickle cell people. So as a carrier, you should know that you need, they need to know it if you're going for, as I said, general anesthesia, or if you're going to be a fighter pilot and you're up in the air with no pressurized aircrafts are pressurized, commercial aircrafts are pressurized. So as a carrier, you don't need to be careful about flying. But if you're going to be a fighter pilot, you need to, and deep sea diving as well, anywhere where the oxygen concentration is lowered as a carrier. But as I said, that's carrier status. You don't have the condition. Sometimes people call carrier the condition and mix it up. A lot of West Africans know it better as trait, which I think is the better term if your viewership is African, West African. Let me talk about who gets the condition, because I think that's important. People from the Middle East, Asia, the Mediterranean, Africa, and the Caribbean are those that commonly get sickle cell. It's not to say exclusively, because here there's a screening program in the UK, screening all newborn babies. It's antenatal. It screens the pregnant woman to see if she's a carrier, and then if she's a carrier, they screen the father to get tested as well, because 2 carriers have a 25% chance of having a child with sickle cell.